Hello everyone, welcome to BigCoin Vietnam channel. My name is Bonita and I'm from the core team of BigCoin Vietnam. Today I'm very glad to have with us the Solve.Care Foundation CEO, Mr. Pradeep Goel. Solve.Care is a global company that builds a healthcare payment and administration platform on blockchains and is one of the first companies that actually deliver a real blockchain use case implementation. So Solve.Care provides this platform to more than 5,500 physicians. So first of all, to declare, this video is not a financial advice and investing in cryptos in ICO is tricky. So please do your own research and consult other resources as well. So welcome to the AMA, Mr. Pradeep. So could you please introduce about yourself?
Yes, thank you, Bonita, for having me. And my name is Pradeep. I'm the CEO of Solve.Care Foundation. And it is a pleasure to be here and speak to the Vietnamese community. I have been in healthcare all my life in the US in various executive roles. I've been doing healthcare since I was first started my company in 1991, so 27 years in healthcare IT, and in various different roles in government and in commercial insurance for healthcare. So it is a pleasure to lead Solve.Care Foundation.
Okay, that's great. So you have been working for Solve.Care for a long time, and can you please share with me and the communities briefly introduce about Solve.Care Foundation and its vision?
So Solve.Care Foundation is building a platform to really streamline healthcare, and from 3 points of view. First, from a patient and family's point of view, making it easier to find the right physician, to make the right appointments, to see the right specialists, and to pay for them in a very convenient way. From a employer and from an administrator perspective, to streamline all the back office functions that frustrate the patient or the doctor.
Yes.
So from an insurance company perspective, to reduce all the friction out of the system. And then finally, from a government perspective, to really make sure that the people are getting the kind of healthcare they need and to are paying for the right quality. So we call it the three pillars of healthcare: the access to care, the outcomes of care, and the performance and cost of care. So you and I should be able to access care more effectively, measure the quality of the care, and pay for it in a proper way. And that is a challenge both in the US and in Uganda and around the world. And we see blockchain as a way to connect these parties in a more effective and efficient manner than is currently possible.
Okay, so Solve.Care provide the method to connect patients to the doctor and some kind to the healthcare system. Is that right?
Correct. So the idea is to allow the patient to have more power. We call it delegated authority to the patient.
Yeah.
So you and I should be able to do more for our parents and for our children in a way that we can both find them the right care and pay for it, and to be able to measure and monitor the quality of it.
Okay.
Whether it is they have any diseases, or we're just trying to keep them healthy, or they have some kind of trauma. In all scenarios, whether it's preventative care, wellness care, or episodic care, there is a tremendous amount of cost, friction, waste, inefficiencies in the process. Physicians and patients and insurers and employers and governments don't really talk to each other in a way that the patient-centric healthcare can be delivered. So we are very focused on making healthcare patient-centric and using blockchain as a way to surround the patient with all the care that they need.
Yeah. Okay, that sounds great. And could you tell me, where are you from, and when and why did you come up with the idea of developing Solve.Care? And what has put you to this decision? Very challenging but very promising one.
So healthcare is complex around the world, but it's always a very humanly impactful. It's very important to all of us. I've been in healthcare all my life. I was very lucky to get into healthcare when I was very young and in my early career. And over the years, I've worked in every possible healthcare position, from the mailroom to the boardroom. And I've had the opportunity to build, buy, operate, manage all the major healthcare IT systems, be it clinical, financial, administrative, government, or commercial insurance, or patient disease management. And I realized over the years that no matter how much money we spend, our fundamental approach is not really patient-centric. And we keep building bigger and bigger systems and more complex systems that cost, at least in the US, hundreds of millions of dollars to build and tens of millions a year to operate. But yet I as a patient
Mm-hmm.
cannot really use those systems,
Mm-hmm.
and they're not really designed to help me talk to my doctor or my
Mm-hmm.
specialist or my lab in a
Yeah.
correct, or even to order a ride to the doctor's office in a proper way.
Mm-hmm.
So having built those systems, I realized that we need a different approach. I was looking for decentralization and realized that the distributed ledger technology, also known as blockchain, can
Mm-hmm.
help me redesign the relationships. So I left a very comfortable uh, position in a large organization to start Solve.Care to fix the things that I believe blockchain can help us fix. There was also a personal experience, even though I was very deeply involved in healthcare and still am every single day, with access to all the top decision makers in healthcare. When my 3-year-old son got sick and needed a lot of care, none of those contacts were very useful because the system is so difficult to use.
Yeah.
So I started to question this fact that if I cannot use healthcare with all my knowledge and contacts in a proper way, then no one else can either. So it became very clear that we need a patient-centric approach. We need a network around the patient,
Mm-hmm.
and we need a network that consists of people the patient trusts and needs to connect with. And we
Okay.
can create these micro networks which are safe, secure, financially stable, and verifiable using the Solve.Care platform and blockchain. So that's the vision, and this, it's personal experience, it's professional experience, and it's very deep knowledge of healthcare, which helps me understand how to use blockchain the right way.
Okay, great. So you mean like building blockchain in order to like connect patient and doctors and make the low fee for them, and that's why like make the flexible with the like history of the patients in order for them to like well prepare for the next healthcare preparations. Is that right?
So think of it this way. We create patient-centric network that consists of all the people that the patient needs to connect with
Yes.
to achieve a best healthcare outcome. So be it your family,
Mm-hmm.
your doctor, your specialist, your pharmacy, even your driver who will take you to the doctor's office and bring you back home,
Yeah.
the dialysis center, and so on. But every one of us only talks to a certain number of people. And those people are part of a bigger network called insurance network or clinical network.
Yeah.
So we are using blockchain to create networks within networks within networks, which are really designed to deliver the best value to the patient.
Okay.
So I, as an employer, can create a network for my employees, but then each of my employees can create a network with their doctor, and the doctors can create a network with their specialists and their nurses, and it allows us to create this very powerful patient-centric delivery model.
Yeah. Okay.
But the big network, the main net, can still be managed by an insurance company or by a government agency or by an employer, so they can manage the financial cost and the administrative functions.
Yeah.
But all of us can manage our care as best as we want to and can. So this patient-centric network, what we call care administration networks, are based on the blockchain, which then connects all these networks together into an employer network, which connects all those networks into an insurance network.
Okay, I see. So like the people that joining to the network will be recorded their healthcare like recording, right? Okay, so
Yeah, so every one of us has a care wallet, and
Yeah.
that care wallet allows us to choose who we can connect with. So I can
Yes.
connect my care wallet with you, and in doing so, I'm very much controlling what information I share with you.
Okay, I see. Yeah, it would be like much convenient. Like we can see the record
Very
of the healthcare. Yeah, that's cool. So how do you rate the current centralized healthcare system, and how are you changing it with blockchain? You have mentioned it before, right? So let's sum up a little bit.
Absolutely. So the current centralized systems have a purpose. They are clearly the logic and the data repositories, and you have eligibility system, enrollment system, disease management system, hospital management system, and each of these systems is owned by a large organization, whether it's the insurance company or it's a clinical hospital. They all have their own systems, and these systems serve a specific purpose. But these systems are never designed for the patient or even the doctor to use them directly. They are designed to administer the back end.
Yeah.
So what we are looking to do is to connect, and these systems are always struggling to integrate with each other. We call it interoperability or integration. and the systems are not designed, and the business model is not designed for these systems to talk to each other. So our platform sits between them. It says, I can give the patient a care wallet, which sits on both a semi-private and a public blockchain that allows the right people to connect with each other at a human, at a professional level. And this blockchain fabric or Solve.Care platform can then feed the data on the back end through the chain into whatever system needs it, and also read the data from the back end system that we need it. But generally, we are focused on creating a peer-to-peer transactional capability between patient, doctor, employer, broker, nurse, driver, pharmacist, who do not have these systems. You don't have a mainframe in your living room as a patient. When you go home, you don't have a data center to operate a big, huge clinical management software. So you have a phone, and your phone or your laptop, and that's your computing power. Of course, the insurance company, me as a CIO of an insurance company, I have a data center with hundreds of millions of dollars of equipment in it. But what do you have? You have nothing but laptop and a phone, and that's all you need. So our objective is to allow a distributed ledger to sit inside every care wallet that allows all of us that need to talk to each other without buying a mainframe and putting it in a basement. Now, of course, our systems ultimately in certain flows needs to talk to and exchange data with backend. But those interfaces largely exist today. So we are the fabric that connects the people together. The people who matter are me, my family, my doctor, my pharmacist, my therapist, my physical therapist, and so on. And allows all of us to then share our useful data to the backend system and read the useful data from the backend system. So we minimize the dependence on the backend. But those backend systems exist and will remain in place, but we are making them a lot more human-oriented by using the blockchain as a decentralized process, distribution of trust, delegation of authority, and peer-to-peer transaction capability.
Yeah, like the emission, like the vision of blockchain, really, right? Yes. So
correct. Our goal is to use blockchain for you and I. So then our blockchain can talk to the backend systems, the centralized systems as needed.
Okay, I see. That's great. So, can you tell me like the most outstanding feature of Solve.Care, and what are the most exciting features that Solve.Care is implementing?
So we are a very broad and strong platform, very well architected multi-tier platform on blockchain. So we spent tremendous amount of time, several years, working on the information architecture and design of the blockchain. And what that does is gives us the ability to solve problems that are very difficult to solve. So be it coordination of care. Let's say that I develop diabetes or I have risk of diabetes. I can have a much more useful diabetic-centric care administration network, which can have patients or potential diabetics around the world in a care coordination manner, where we can have meaningful clinical, financial, administrative network, which can give me tremendous power in managing my disease condition. Or it can be around health care needs around. We are working on right now a program where we are dealing with setting up a care administration network for pregnant women who are at risk. So giving them all the prenatal advice, making sure that they have necessary checkups, even getting them the ability to book a ride for their appointment, and making sure that they get to the appointment, making sure that they have the right prescriptions and the nutritional support, and doing all those things to prevent any kind of a challenge during birth or postpartum issues. That's a huge issue, because if you can prevent issues in the early days of child's life, you can prevent a lot of issues down the road. So those are the type of scenarios: diabetes, cancer, prenatal and postpartum care, mental health, homelessness. There are so many social and medical conditions around the world for which we can build very specialized networks that are patient-centric and localized into each country. What works in US does not necessarily work in Vietnam, but we can configure in Vietnam own care-centric administration networks that will work in Vietnam for the Vietnamese doctors and patients. So the objective is to have a truly global healthcare platform that can work in any country and can be localized by a care community in that region. So we expect to bring our platform to every part of the world with the same model, but very different implementation.
Okay, that's like I think that the healthcare system in Vietnam and the US is not much different because people like have to wait a long hour for like for to have health take and something like that. So and I would like to ask about the token sale. So how did you end your token sale?
So we had a very successful token sale. We met our objectives. We completely sold out our token sale. All tokens that we had offered for sale were accounted for. So we're very happy with that. We're very proud of the fact that we did the token sale in a very conservative way. We followed all the best practices. We applied all the most conservative approaches. We filed for the SEC exemption in the US. We made sure that every single person who bought a token understands the purpose of buying the token, as well as we made sure we know who they are.
Yeah.
So we did a very clean, very conservative, very well-run sale, and we also dealt with a lot of changes in the market as the token sale was going on. But we feel that our strong, clear message, our very clear purpose, and a strong team that is already building and deploying the platform, our experience in healthcare, all of that contributed. But we are very thankful to the global community. We had people buy our tokens from, I believe, over 100 different countries, all looking, and we heard this from the community all the time, that what we need is a better healthcare delivery system, and your platform is looking to bring that to us. So we are as interested in Afghanistan about healthcare as we are in the US. So we are very excited about the possibilities that we have in front of us, but we are also very proud of the way we ran the token sale as well.
Okay, so it's great to hear the good news from your team. And I would like to ask about your team as well. So for the team, how many members are there in the team, and how many developers and engineers are there? And can you tell me a little bit about their strengths?
So we have a little bit more than 60 people right now, and of course we are hiring every day.
Yeah.
And about 50% of them are in the development team, and the 50% are in delivery, support, and marketing, business development, and finance, IT, legal, HR, all those functions.
Yeah.
We have a complete, fully running company now. We are no longer just a project. We are serving serious clients in the US. As a result, we are building an organization that is you would find when you walk into any mature, existing, and strong global organization.
Wow.
So and it will be about 100 people by the end of the year. So we are growing quite quickly, but we are being very careful in who we bring into the organization. We're very strong about our culture. We are a mission-driven company, and we want to make sure that people who join our organization share our mission. But that being said, I'm very proud of the team we have, and I am looking forward to seeing the organization scale globally as we move forward.
Okay, I see. So like you've mentioned about like turning a project into a company, right? So can you tell me like have you facing any like challenges when turning a project into the company?
Yes, of course. This is my 5th company. I have built 4 other healthcare companies before, and the journey is always similar but different. The challenges are the same. How you solve them is always different depending on the team you have. But building a company always has the issue of making sure you have the right people in the right place, you have the right brand, the right product, you're communicating your value to the market clearly through marketing, you are choosing the right customer, and when you have the customer, you serve them the right way. Those are standard management principles. They're easy to understand, they're difficult to execute, but I've done it before many times. And I always tell my team, every day I come to the office, I see a movie I've seen before, but the ending is always different. Every day is exciting and new, but nothing is that new. We've been there, done that many times.
Yeah.
So it's very exciting to be building Solve.Care. This is one of my best projects, or best companies to build, and we have made the most progress in the shortest time. And I was known for building companies very fast and very well, but this one is my best experience.
Yeah, okay, great to hear so. And you've mentioned about the K wallet. So I see that there will be the Solve token, right? So can you tell me about what is the utility of Solve token in the Solve.Care platform?
Yeah, absolutely. The Solve token is the foundation for our economic model for the care wallets. So care wallets are being issued to physicians, uh, patients, and all other stakeholders: employer, broker, pharmacist, even the taxi driver who needs to take you to the doctor.
Wow.
So each person has either an economic role as a payor or a payee. Either I'm paying or I'm receiving payments. So Solve token serves as a currency that allows me to transact between wallets. The second thing the Solve token does is gives me the ability to receive third-party funds and pay others. So insurance company can give me Solve coins to pay a doctor on their behalf. The third is I need Solve tokens to pay for care wallet fee, or my employer needs Solve tokens to pay for care wallet fees to Solve.Care Foundation or to the local network administrator. Care wallet fee, or my employer needs Solve tokens to pay for care wallet fees to Solve.Care Foundation or to the local network administrator. Developers who want to build more care cards and publish them on the Solve.Care platform in the marketplace and want you and I to use those care cards in the care wallet, they need Solve tokens in escrow to back up their publications, and they receive Solve tokens from you and I when we use them, when we use their cards. So it's really the economic engine for the platform. It serves the needs of the employer, the government agency, the hospital, the patient, the pharmacy, the doctor. All of us are connected by Solve tokens in terms of our payment vehicle.
Okay.
The second is the Solve token also carries with it the ability for us to ensure that whatever is being published on the care marketplace is backed by quality and by service of the publisher. Because our goal is to have care cards for every country in local language. So Vietnamese care cards are coming and Chinese care cards are coming. And those cards, when you publish them and when you use them, the monetary engine behind them is Solve token. So it's a very high utility token that is really designed to create an economic model that allows the patient to pay the doctor, the insurance company to pay the doctor, for you and I to pay the transportation company, or for the pharmacy to send us discount for buying pharmacy the second time, and so on. Every economic transaction that takes place in healthcare, we have mapped that to Solve tokens.
Okay, so I agree with your idea. So you've mentioned about marketing strategy as well, right? So you are developing Vietnamese community. So do you have a plan for Vietnamese localizations of Solve.Care?
Absolutely. We see Vietnam very attractive for two reasons. One, we have had tremendous support from the Vietnamese community during the token sale. So we committed during the token sale that we will come back and invest in Vietnam, if you will. So we're looking for development partners and care card publishers in Vietnam who will build cards not for Vietnamese market, for Vietnamese patients and doctors, but also globally for English-speaking markets. So we see an opportunity to have development partners in Vietnam who can localize a platform for Vietnam and all of the Southeast Asia near Vietnam, Laos, Cambodia, Thailand, Malaysia, Indonesia. We see that as an area that the Vietnamese community of developers can serve. And we also hope that they can serve other markets, the G20 economies, by publishing care cards in English and other languages. The second reason is that we would like to launch Solve.Care platform in Vietnam in terms of the care wallet. And we're looking for partners who will take our platform and do the appropriate localization and customization for use by Vietnamese hospitals and by large clinics and patients. So we have two objectives: the development partnerships in Vietnam and the launch of our platform for the local population in Vietnam as well.
Okay, I see. So when are you going to go live and with the solutions of Solve.Care?
So our plan is to go live in the next, we originally planned to go live end of August. Our client wants a little bit more time for testing. So we are pushing them to go live in September, early September. It depends upon their physician testing that they're doing. They are talking to a lot of physicians one-on-one and sharing the care wallet with them. But I expect that both the patient wallet and the physician wallet will go live in September. That is our goal. There's a lot to be done, and we're working hard to get it done. But we really would like to see both these wallets live and in use in September.
Okay, so I can't wait to September to see the good news from your team. Okay, so here is the last, maybe the next questions for you. So what kind of strategy will Solve.Care implement to attract more business or more users over to the Solve.Care ecosystem?
The strategy. So we have, it's a very good question because there's a different strategy for different regions. So initially we focused on North America. And in North America, we have tremendous history and experience with insurance business and with government agencies. So we are very much focused on the businesses and B2B model, as we call it, where we are speaking with large insurance organizations, which are